Hello and welcome to Lynchburg Live. I'm your host, Linda Smith. In recognition of Operating Room Nurses Week, November 7th through the 13th, we're here this afternoon at the Surgery Center of Lynchburg. We're going to be meeting some of the registered nurses and staff who work here, and Jan Claybrook, nurse manager, is going to take us on a tour of the facility. We hope you enjoyed the show.
Well, I'm the administrative director here, and I just am over, we've got about 39 employees here, and 3 operating rooms and 2 procedure rooms, and I just oversee the whole operation with, I have different people in charge of different areas, but I just oversee it and take care of the regulatory end and the paperwork end.
And the budget, that kind of thing. I remember that. Tell me how long the Surgery Center has been in Lynchburg.
We did our first case in May of 2001, so it's been just a little over 10 years.
Goodness, it's hard to believe that it's been that long. Jan and I worked together in the operating room at Lynchburg General before she took this job. What localities does this surgery center serve?
We serve Lynchburg and all the surrounding counties of Amherst and Bedford and Campbell County and Appomattox County. We're at 2401 Atherholt Road, right across the street basically from Lynchburg General Hospital. There's people here at 6 o'clock in the morning. The patients start arriving at 6:30, and we're usually done operating here by 3:30 on most days. Some days it runs over a little later, but our goal is to be finished completely by 4:30, and that varies because it depends on when the patients are ready to go home.
And you don't do any call or weekends?
No.
Okay, that's wonderful. I remember.
Yeah.
All right, Jan, what would you say are the advantages of having surgery here for the patient?
I think having the surgery center here, since we only do elective scheduled cases, I think that it enables the patients to have their surgery scheduled on a more timely basis. Right. It just gives us an additional venue to schedule. We don't have any emergent cases here, so all of our scheduled procedures are more apt to be on time. We don't have surgeries being rescheduled because of emergency room patients or anything like that. Also, our patients here are healthy, and so there's less chance of patients getting infections and or coming in contact with other people that are sick by having their surgery here.
What kinds of surgery do you actually do here at the Surgery Center?
We do lots of different specialties. We do a lot of orthopedics and a lot of ENT, a lot of ear tubes and tonsils on children. We have a pretty big pain management program here. We do some general surgery, some urology cases, some GYN cases, and we do ophthalmology, cataract cases.
Jan, you had mentioned that the physical conditions of your patients and how that contributes to the overall good of the center and how well it runs. Can you tell us about that?
We have pretty specific guidelines about the selection of the patients here. Our patients are overall healthy. We will do patients with some health problems, such as high blood pressure, diabetes, any health problem where it's well controlled, and everybody always has something, some little something wrong with them. But overall, they're healthy, and we foresee a positive outcome with those patients. Right. And the ones that we don't foresee having to be admitted to the hospital, they're the ones that we try to do here.
You don't have the kind of surprises that you do.
Right. That's our goal.
You said you did children here.
Yes.
And
yes.
You said tonsils.
Yes, we'll do anywhere. Children have to be at least 6 months old. And if they're younger than that, it would be an extenuating circumstance, but our policy says that they have to be at least 6 months old to have surgery here.
You do local and general anesthetics.
Yes.
Could you tell our audience the difference?
Local anesthetic is just where you're injected with some like Novocaine at the dentist's office. It's called xylocaine or lidocaine. And those patients, they could possibly get a little bit of IV sedation just to kind of knock the edge off, but they're basically awake and can respond to commands. And then we do general anesthesia, and that's where an anesthesiologist is actually there, and they go to sleep and are not aware of anything while the surgery's going on.
That's great. And you all are fully equipped. I mean, you have all the most up-to-date equipment for the procedures that you do?
We do. We have to we have to adhere to all the same guidelines as the hospital does,
Right.
in that we have a crash cart here with a defibrillator on it. All of our nurses here are ACLS certified, advanced cardiac
Wonderful.
life support. And of course, everybody has basic CPR, the scrub techs and everybody, but all the registered nurses are ACLS certified, and I have about 5 or 6 nurses here now that are pediatric advanced life support certified.
That's certainly a plus,
Yes.
as long as you're doing these kids.
Yes.
I think everybody is interested in knowing that they're in good hands and that the hands they're in are as safe as they are at the hospital.
Yeah, you have to be, you know, whether we had to be or not, but according to the state rules and regulations, you know, we would be. But yeah, I don't think people are aware of all the rules and regulations that the state requires for you to be able to be licensed, and we have met all those requirements.
Your turnaround time between cases, I know that that's an important factor in moving your schedule along. Can you tell us a little bit about that?
We do, you know, we have a specific set of cases that are considered outpatient surgery cases, and so that's our focus. And so when you do the same thing over and over and over, you know, you get better at it.
Right.
And we have the same cases not only every day, but throughout the day. It's the same set of cases. And so with that being said, when you do that, you have everything that you need right there. It's not moving equipment out and moving equipment in. And all of that's a time-saving systems that we have. And so we have everything ready the day before for the next day. And that's another thing that's different from the hospital. They're
Right.
operating sometimes all night. You can't really get ready for the next day until the next day. So we're ready a day in advance. We have everything that we need for the case, and there's not a lot of equipment moving. And so we pretty well much are able to take one patient out, and then there's a whole crew that's in there getting ready for the next case, and then the circulator will bring your next patient in there, and everything's ready.
So your turnover time is really quite good.
It's just time enough for the anesthesiologist to talk to their next patient and get the paperwork and everything, make sure all that's squared away, and then we're ready to go.
How many cases do you do here approximately a week? Did I ask you that already?
We do about 600 cases a month. How about that?
And that's a lot. That's
It
really
is. Now, a lot of that are pain clinic patients. That, you know, they move pretty quickly. The eyes, you know, they are short cases. The ENT cases are usually pretty short cases, and so it's big numbers because it's so many short cases.
How many surgical rooms do you have?
We have 3 operating rooms that are set up for general anesthesia, and then we have 2 procedure rooms where we can do locals in.
Now, your nurses and technicians, are they all trained in everything, or do you have people who are do specific jobs, like a specific set of nurses or a team that does cataracts, a specific set or a team that does arthroscopy?
Everybody's trained in everything.
Good. I mean, I think that makes it so easy, or so much easier, to
Oh,
move
yeah.
staff around when, you know.
Absolutely. Everybody here, I've got people trained. Not only can they do all the cases in the back, but I have a fair amount of employees that can also go to the front and work in pre-op in the recovery room. So we try to cross-train as much as we can here.
I think that's really to your
It works
credit.
well. It works well.
Now, for the families who come here, you know, waiting for a family member to have surgery, this looks like such a comfortable facility, and I'm sure that it's so much easier for them because they don't have the hassle of trying to find where everything is. Everything's located in one spot, and you have parking that you don't have to drive around in the parking lot for hours. So, have you gotten comments from people, from families, you know, how they feel about bringing a family member here?
Well, we have a lot of patient satisfaction surveys that we get back, and those are just glowing. People really like the atmosphere here, and we allow the families to be with them. You know, they can come back with them while we're getting them ready if they want to, but we have found most of them don't really want to do that. So we get them ready, and we let the patients their families come back as soon as possible, and then as soon as we are as the patient wakes up and we have them over in the step-down area, we go and get their family, and we don't really limit, how many. We do have a little bit of a space issue here with, huge families coming, but we don't really have rules and stuff as far as how many family members can be with them, because I just feel like if they need that many people here with them, they know they're coming, they want them here, and it's not up to me to judge and tell them they can't have them. So we try to accommodate the families to be with them as much as they can when they're here.
What do you see as the greatest advantage for the patient to be here?
Well, it's a smaller, a little bit homier atmosphere here. The nurses are working right outside the rooms, and so they have easy access. You don't have to push a call button and wait for somebody to come. The nurses are standing right there. Right. It's just I feel like it's a little less intimidating, maybe, especially to the children. It's just like going to the doctor's office.
Right. And it sounds like you have more one-on-one, really, somebody's always there.
Somebody's always there, because it's such a small area.
What are the advantages, would you say, for your staff that are working here, and for you, too?
Surgery is our thing here. I love surgery, I always have. It's
right.
one of those things that gets in your blood. But I think working here, we get to do surgery, which is what we love. And we have good outcomes here.
Right.
Everybody goes home. We see the patient from the time they roll in the door to the time they leave. You know what happens to them. You know how they've done. It's just, like I say, you get to do what you love to do in the best situation possible.
So there are more rewards, you feel, for the staff than they are.
So.
I could imagine that, I remember in the operating room, how fast-paced everything is. And you're fast-paced here, but it's a different kind of...
It's a different kind. Our patients are, like I say, they're healthy. They're not coming in, through the emergency room, something unexpected, or that they're scared to death. And, we don't have any life-threatening things. And there's some, some people like that sort of nursing.
I know.
And thank goodness for that. But, like me personally, I really didn't. I like the predictable,
right.
and so this is just perfect for me, and apparently my staff, the ones that are here, like it too. So,
Jan, if you could tell our audience one positive aspect of the Surgery Center and why you think it's important to this community, what would you say?
We have a fabulous hospital system here in town, and if you're sick or hurt and you need inpatient, we are very fortunate to have the hospital. But I think for the elective surgeries, I think that to have an alternative, to have it done in a clean, safe environment is such a plus for the community.
That's similar to the hospital.
It is very similar to the hospital. We have to meet pretty well much the same regulations as the operating room. I can't say the hospital overall, because our focus is surgery. But as far as what we do here and how we do it, I came from the hospital. It's very similar.
Yeah.
Very similar.
This is the outfit I wore all my life when I worked in the operating room. Yay!
It's my staff.
Jan, why don't you take us down the hall and introduce us to some of these really strange people?
Okay, so this is Erica and Julie. I'm going to introduce you to the registered nurses first.
Okay.
Erica and Julie and Chauncey, and there's Monica and Lindsay and Margaret. And then I got 3 scrub techs. That's Jerry and Dwayne and Pat. And then BJ there's my x-ray tech. Rowena's my scrub tech also, sorry. And then April is my decontam girl. Did I get everybody?
Only decontam girl? Mm-hmm. My goodness, she must be wonderful.
She is.
RN staff, tell us what it means to you working here at the Surgery Center.
We have awesome teamwork. We have a circulator that's assigned to each room, and so what we do is we don't just leave that circulator in there by themselves. One person is hooking the patient up to the monitors, one person is making sure all of our supplies are in order, one person is already starting to chart. So we just work very well together. We just have this great collaboration as a team, I think.
That's true. Very true.
Yeah.
I think teamwork, if you're going to work closely together and in an operating room setting, and in this setting, which is an operating room setting, you're really as much like family as anything, because you're thrown together 5 days a week, you know, in really tight quarters, doing things that are saving people's lives. And I think there's something really different about that kind of job, being there, being responsible for being the custodians of people's lives while they're under anesthetics. So, you know, I commend you all for what you do.
Thank you.
You did a great job. Who can tell me what they like about their job?
We're all family here, and when it's time to go home, if only one room's working, everybody jumps in on that room and helps finish up the day, so nobody's left here by themselves to finish up alone, so we can all leave together.
How hectic is your day? I mean, your pace, I know you have a very fast pace.
Well, we've done as many as 60 cases in a day.
I think that's
pretty
wonderful.
hectic.
Yeah, that is hectic. With 3 rooms?
4 count pain clinic.
I think we have a better relationship with the physicians too, because we are around them so much more, and it does seem a lot more family oriented, because we have to, you know, we're in that room with that patient, so we can spend time with them, and they treat us like family as well. So
It really is a different atmosphere with the surgeons.
oh yeah.
Even, you know, in the hospital setting, when I was working in the operating room, your relationship with them is so different because you're working really closely with them. It's so different than the relationship the nurses have on the floor with the physicians. So tell us what you like. What do you like about the job besides teamwork?
The weekends, the holidays.
Nights, no calls.
That's a good
The hours are good, the weekends are good, we have holidays off, and even sometimes on like Thanksgiving, we get day after Thanksgiving off, so that gives us a 4-day weekend.
Go shopping.
Sometimes we have shopping. We have 3-day weekends when it's like 4th of July, Memorial Day, so that's a perk here.
And we get lunch free once a week.
Yes.
And we have a wonderful boss.
And we have a boss that will come back and work with us.
Exactly.
And for some reason, we
And
have
sticks up
someone
for us.
sick, she will come and work in the room with us, just like a social
She's one of
worker
us.
does.
She doesn't separate herself as like she's a boss and stays in the office. She
Yes.
comes back and she'll work pre-op, she'll work in the operating room, wherever there's a need.
Don't you think a lot of that is because she's worked in your position
Oh, yeah.
before?
Yes.
And I think if you're really going to know what something's like, you have to do it. So
Absolutely.
you're lucky to have Jan having
Yeah.
been down there.
And it's not even bonus time.
Not evaluation time.
Not evaluation
That's
time.
one of the reasons everybody that works here is so happy, because she's one of us.
Yeah, it
It
certainly
makes a difference. The patients like it because they'll say, you people, everybody here is happy, because we are.
I think that's great.
Thumbs up.
Thumbs up.
Is there anything you'd like to say to Lynchburg and surrounding counties and people in New Zealand and every place that's going to see this show?
Come have your surgery at the surgery center.
The Surgery Center of Lynchburg. We'll take good care of you. That's right.
And if you have surgery here, you're in excellent hands.
Every
Yeah.
time.
Do you have anything you want to encourage these people to say?
I don't think so. I think they covered it all pretty well. They read by the script, I guess.
Glad you gave them the script ahead of time. Now, are you the only male person who works here?
Couldn't be happier.
You get to work with all women.
That's right.
I was
Yeah,
going to
what
say,
is it
how
like to
is
work
that?
with all these women?
It can be challenging. It's very rewarding at the same time. So they take good care of me, being the only male. They just kind of take care of me.
We treat him like one of
Yeah, we treat him
Yeah, they do. They're
And
just
he
wonderful.
learns a lot too.
I know when to say something, when not to.
I understand.
These are the people that nobody remembers. These are the people, when we get patient satisfaction surveys, these are the people that never get mentioned because nobody remembers them. And they, you know, they're such a hard working group, and they always have the patient's need, you know, make sure they're warm and, you know, positioned right so there's no injury. And I don't think people realize they remember the people that got them ready, they remember the people that take care of them afterwards, but nobody ever remembers this group. So we want to make sure that people know that they are a very integral part of this facility.
The forgotten group.
The forgotten group, right? Because we don't ever get anybody that says, "Oh, Lindsay did a great job," because they don't know who Lindsay is. So
and they really weren't there for
Do now.
All right, Jan, tell me where we're going. What's the first thing you're going to show us?
We're going to go into one of the operating rooms and let you see a typical operating room. We've got this ready for Monday's cases.
Okay.
So this just shows we've got, the regular OR table, and that's what we use for almost all of our procedures here. And you'll see that's the anesthesia machine over there with the green balloon on it. And that's all the monitors they hook every patient up to. We do a lot of video cases, all of our arthroscopies and some of our ENT cases, urology cases, GYN cases, all of them use cameras. We have a tower over here that has the TV screen on it.
Now this is for scopes.
Yes, and it's the light source and the camera source. We've got a printer where you can actually print the pictures, and we also have it's called an image capture system. We actually have the capability of sending the pictures directly to the doctor's office and directly into our electronic medical records. And so we're trying to cut down on...
That's wonderful.
Yeah, we're trying to cut down on paper and all of that.
Do you also do laparoscopic gallbladder?
Yes, we do laparoscopic gallbladders over here. We do the FESS procedures, the endoscopic sinus surgery. A lot of knee arthroscopies and shoulder arthroscopies. The GYN doctors will do a lot of laparoscopies, and we do a lot of video work over here.
What is this? The
Neptune?
The Neptune, what is that?
The Neptune, what that is it's an actual suction machine, and you hook the suction tubing up to it, and all the fluid or whatever is sucked into that machine, and at the end of the day we go and attach it to a a gizmo, and it drains all the water and bloody stuff out of there.
I just hadn't seen that. That's
it's
something new.
It's new, and we've had it, I don't know, for a little over a year, I guess. It used to be we had suction canisters that were full of water from the arthroscopies, and we carry them down the hall. So it's just a matter of time before somebody drops them, and all that stuff goes all over the floor. This is a contained system.
That's a wonderful
that goes
method.
Right down into the sewage system, and yeah, that is a wonderful thing. It's the best thing we've bought since we've been here.
Now these things wrapped up in blue.
Those are trays of instruments. I've got trays of instruments in metal containers, and I have some of them wrapped. Those are the instruments that are ready to use on Monday. And then over here, we've just got all the little supplies, the bandages, the blades, all those disposable things are in there for the cases.
It certainly is well put together. I mean, everything is compact
right here, and this is everything we need for the day on Monday. There's always little things you have to run out and get, or somebody gets for you. But every room is equipped with a PC for the doctors to use, and then every room is equipped with a tablet for the nurses to use for electronic medical records. We have a tablet for the nurses and a tablet for the anesthesiologist. So this is the room right here where everything is put after it's all processed. So this is where it's stored. When we're ready to pull something for a case, this is where we come for the instruments.
Right.
And then April, she's still working. Everybody else has gone home. But anyway, we've got a big autoclave.
All right, for those who don't know what an autoclave is.
That's true. This is an autoclave, and what that is, it's a steam autoclave. And you have to run, depending on whether the instruments are wrapped or not wrapped, then when they come out, it cooks it at like 270 degrees, and so they're very hot. They have to cool, and then they're ready to be used.
And there are several different types of sterilizers in this room. These two are also sterilizers of a different kind.
Yeah, they're called Steris machines, and we use those for things that cannot tolerate the high temperature of steam autoclave. Fortunately, most everything we have here now is steam autoclavable, except for just a couple of little things that we seldom use. So these are kind of being phased out, trying to get everything steam autoclaved.
This is a chemical sterilization as opposed to acid. Heat under pressure.
Right. Right. Yeah.
Well, I commend you for doing this job all by yourself.
Thank you.
We don't realize how much we appreciate April until she goes on vacation. We have an equipment alcove right here, and what this alcove has is all of our positioning equipment that we use, and that's all of that over here. These are stirrups that we would use for like the GYN procedures and urology procedures. We have leg holders. We put the leg in a holder like when we do knee arthroscopies. And then we have a bunch of carts over here that hold our implants and our suture. There's a phenomenal amount of inventory.
Oh, I'm sure.
Used at a surgery center. But over here are mostly our implant, suture, positioning devices, and we have some x-ray aprons and our microscopes. What we try to put here are things that we use frequently. Microscopes are used for ear tubes, and so, you know, we try to keep all that over here. Right here we have an emergency airway cart. That's in case we have any trouble with the airway in the room. So we have all the emergency equipment that we would need to manage an airway right there.
This is where everybody washes their hands before they do the surgical procedures.
Yeah, this room is set up for eyes on Monday. And we have our own little pharmacy sort of kind of in here. This is where we keep our narcotics. Probably don't want to, but we keep them locked. And you know, after hours, you know, the place has to be very secure. We've got motion sensors in here. And
why is it always so cold?
You know, it's for a couple reasons. First of all, it's cold back here because bacteria and stuff doesn't like the cold. And so it helps with the infection. But also when you're in there operating and you're under the lights and you have a mask on and a hat and your gown and your gloves and you're working, and it's hard work. You know, sometimes pulling on retractors and different things. It gets hot. And the last thing you want is your doctor to pass out. But for the patients, we have blankets that are kept. It looks like a refrigerator, but it's a warmer. We have warm blankets, and we also have, it's called a hot dog warmer, and it actually is a blanket that lays on you and is hooked up to an electrical source, and that keeps the patients warm. So we have lots of things here to keep the patients warm, but at the same time the staff is comfortable.
Yeah.
While they're
Plus
working.
The nurses put on more
jackets. I've got on lots of clothes. This is where we keep all of our disposables in here. And as you can see, it's just a phenomenal amount of stuff just packed on the shelves. We use every square inch of this place. There's no wasted space.
I think that's great.
And once they go into the recovery room, they come up here to one of these bays like this. We have the recliners, and this is where they get their discharge instructions. We get them something to drink, some crackers, or something to settle their stomach, make sure their pain's under control, that their nausea's under control, and this is where their family can come and stay with them. And then from here, they go home. So
it's a really nice area. Really it is.
Yeah, we've got a really nice big area. We've got this, and we've got another recovery area over here, but we really like this because it's got the windows, and we've got the glass up. And
tell us what you like most about it.
Mostly I like the director.
Okay.
Janice Claybrook, RN. She is incredibly competent. She's good looking, and she's just all in all terrific.
And I imagine you're still very fond of nurses.
Yes, I am. They're wonderful people, the men and the women.
Well, of course.
No, it's a very pleasant place to work. People are happy here, and I love being here.
Good. I hope you've enjoyed tonight's show and being able to tour the Surgery Center of Lynchburg and meet some of the staff. My next show will feature the Lynchburg Academy of Fine Arts. Thank you for watching. Have a wonderful evening. Good night.